Good morning, everyone. I'm Dr. Pragati, and today I'm going to tell you about some new things about community medicine. Why I chose community medicine as my post graduation specialization branch. So, since it is the counseling phase, registration process has been started. I wanted to just make some few points, facts, or it's about community medicine, so it will be very easy for you to choose community medicine as branch. So, first one is ARV OPD, which is anti-rabies vaccine OPD. OPD hours is like 9 to 1 or 2, and then we have from 3 to 5. There is PSM in the department seminar. So, yes, the department seminar one. So, in anti-rabies vaccine OPD, we do vaccination of patients who came with history or complaints of animal or dog bite. We give ARV, that is anti-rabies vaccine, and ARS, that is anti-rabies serum. Transdermal around the wound and everything will manage. And all the complications will manage in the OPD itself. Then second one is IPC OPD. IPC OPD is for immunization vaccinations of other things, like child immunization, adult immunization, every kind of vaccination we do it IPC OPD. Both OPDs are generally near in our college, in our hospital. So the third OPD is urban center OPD in the, at USTC. We we handle all the patients like medicine resident. We manage all the patients who come to USTC center. Then fourth one is RSTC. We manage all the patients like medicine people as medicine people manage. Or any MO will manage in rural area. And the population visiting that OPD depends on the population of that area, or we come to that area. So in we have to manage this 4 APDs. We get rotation of like 3 months. As I was late to my joining, I got one month rotation of each, and then 2 months rotation. We all the 3 months rotation of all the 4. As then we have call weeks. I wanted to tell about the call weeks. We had 10 people, 10 residents DR1s. Then we divide all the call days. Not call days, we divide as call week. That one resident will take this week and the next thing. Like we'll rotate it amongst us within our 10 GRs. So the call week is like any patient who comes after the OPD timing. The call person, the on-call doctor will manage all the ARVs and ARS given to that patient. We'll go visit, check history, and we'll do ARV and ARS. So yeah, that was on call. It depends on the patient load, but in general we go by visiting basis. Not staying in that hospital, but we go by visiting basis. That's when the casualty ambulance will call us. Like, PG activity, it is 3 to 4 quizzes, exams, your month-end exams, which is of 3 hours. Journal club will discuss any article specific to that topic and everything. We'll do in PG activity. PG activity is academically oriented. Sometimes it is practically oriented when we visit family and we have family cases. Then we go to the area or field to visit that family and the people who are present in front of the family and us. We see their house, how they live, in what condition they live in, how is their life. And we counsel them according to our findings. So this was about community medicine residency. I wanted to tell you that community medicine residency, why I chose that branch first reason was that I wanted something very nearby to my home, because I don't want to go very far away. That's why I stopped all the options on doing any other branch which I won't get at my place. So even though I would have got any diploma in clinical branch or anything, but I want to, and secure MD is, I thought it is better. I don't know. I don't want to comment if PhD is better or FD something is better. That is your own personal preference, whatever you want. As per the branch, community medicine is very vast branch. Like in general, we also have guest lectures in PJ, and we have like so many within 3 months of my joining. We have airport faculty staff who manage all the vaccination things and stuff, airport security and everything. PSM people who manage that airport landing, all the things, permissions of vaccinations and everything. They have visited us and gave the guest lectures. Then we have this lecture from our DH office people, DH officer, DH office, sir, that how they manage all the administrative works, chikungunya, dengue, and how they manage on the community level, on all the blocks in the cities and everything, the house surveys and how they give their reports to the news channels, how they try to implement different things, how they do everything. that we got when we again visited meteorological center, regional meteorological center, where we got the thing how they measure all the weather changes, and everything, rainfall. There we found out. And also we also did milk factory, milk dairy, how the milk is produced and how the milk is packed, stored, and sent for the public consumption. Transporting the vehicles and everything. We learned about that there. So in general, as we thought that third year that community medicine is very reading and so much big part book like it is very reading and lengthy subject. But as you come to know, it is vast. It's definitely a vast subject and very vague subject. You have to like also make not big things, but you have to learn about so many things, little bit of so many things. All the peds, gynae, medicine, surgery, everything you have to know, but little bit. And how can you practice that in the community? How can you make the policies, programs, or the budget planning, all implementations? How to involve ground root people? How to counsel patients? How to communicate them? How to everything comes under community medicine. So it is like bridge between clinical branch, all the clinical branch like OBGY, pediatrics, and everything, and patients. It is bridge that we are we are able, but we are as a community medicine people, we are better people to counsel them about, because we know we also take in consider their side, we also take in consider clinician side, and we'll find a midway so they can that can be easily accessible, easily affordable to them. Whatever program implementations and everything, that can be easily accessible to them. As a community medicine, we also have one kids dramas to spread the awareness about some diseases in the community. Like recently 2 months back, we have breastfeeding month, then breastfeeding month. So we have planned this speech and command and all the charts and everything for that breastfeeding week. Um, so in general, you learn about public interaction, family adoption program, in which we adopt 5 families per year. We adopt 5 families. When we visit that family, we develop a rapport, we develop all the things, how they live, how the ventilation, how is everything in that family. How can we help them? How can we counsel them? Is there any health problem? If yes, how can we get them more help and get awareness of their health problem and everything? Basically, this subject will teach public speaking. That in you'll be like, if you're a shy person, you will be more interactive or expressive, or you'll be like, at the end of them you'll be knowledgeable about all the how to counsel patients, how to counsel everyone around you. Yeah, the communication is a very big part of community medicine, because there are speeches, we give speeches, we give quiz. There is no, I was very shy, not shy, but like might fear, stage fear kind of person. But now after I joined, I saw that everyone is using mic and no one is nervous around it, and like everyone talks. Because it is so much stage fear is very reduced, because every day you have to be like saying something on the stage or in front of others, like 30 people is there, 30 ARs, 30 SRs, or 10 SRs, or 10 faculties, like 40, 50 people you are saying in front of people. In naturally that your shyness or your low confidence will try to disappear or gets disappear. And that is very good about, I thought that's very good about Raj. And since because we come from very studious background, or we are ingrained, we have ingrained in our brain that we have to study. So we have not learned to interact with people, or sometimes we are very introvert because we are very into the study. Uh, so this branch will literally challenge you if you are such kind of person. But it is in a very good way, because you'll also learn how to talk to people, how to counsel them, how to spread your warmth and everything. That I thought is very beautiful about it. Yeah, it is very work-life balancing branch. I'm balancing my family with this branch residency and everything. I think it is very work-life balance branch. You can after 5 there is no one is going to disturb you or anything. Yeah, you have to study. That is the point. You have to make PPTs, you have to make presentations and everything. But the thing is, you'll be more. You get to stay at home, not only hostel and hospital. You get to stay at home if you live nearby, or visit home sometimes when you want. You can hear the firecrackers because of Diwali. Yeah, because of Diwali. Uh, I hope you can hear me. Okay, what else I can tell you? If you have any queries or anything related to community medicine, please ask me in the comment section, or on any other video I can make, please suggest me in the comment box. Thank you.